Welcome to our Arizona Outpatient Surgery Center, and this is Dr. Elizabeth McConnell, who is a great colorectal surgeon. Today, why don't we talk about what your stool should look like?
So, what does your stool look like?
Mine looks like a yellow banana.
Aha! Well, so the funny part about this is if you ever drive up 16th Street and you see our building, in fact, we'll show you a little picture of it. Very bright yellow building. Our bright yellow building is my reflection on what the perfect stool is supposed to look like. So a perfect stool is supposed to be the size and consistency of a yellow banana.
And that's why mine looks like a yellow banana.
So, I always talk about how if a stool is the size and consistency of a green banana, that's too hard, or constipation. And if it's the size and consistency of a brown banana, that's too soft. I think of it this way. When you take a yellow banana and you peel it, you throw the peel away, you have the banana here, you can eat that yellow banana, and you don't have to use a napkin. If you eat a brown banana, you have lots of extra banana on your hands. A green banana you just really wouldn't want to eat because it's too hard. So when you think about a stool coming through, a stool should not leave any residual. So the residual that you would get from a brown banana would be indication that your stools are too soft. So when we think about diarrhea then, constipation is easy, consistency of a green banana, but diarrhea are like the 50 shades of diarrhea. Diarrhea is from a brown banana all the way to water. So somebody beat us by writing 50 shades of something else, but really it should be the 50 shades of diarrhea, because those are all the varieties of diarrhea you can have, from water to peanut butter to mashed potatoes to brown banana.
Now, explain to me what is so important about having a consistency of a normal stool. Why?
So a normal stool tells you a lot. If you have a normal stool, that means you can actually have a normal stool. So in other words, if you can't get a stool the size and consistency of a yellow banana out, then there might be something wrong with your anus. So many patients come to us unable to have a normal stool. In fact, they have what we call anal stenosis, where the anus is so tight they can't get anything out except for diarrhea. And that could be even watery diarrhea that dribbles out. And they come to us with problems with incontinence, and really the issue isn't about the incontinence, and it really isn't about the problem with the stool. It's a problem with the anus. So it's a really important thing for you to know whether you can have a normal stool or not. If you can't, you need to come see us.
I think the problem is a lot of patients just anal problems. They don't know what it is. They go to their family doctor, their internist, or whoever their first provider is, and they always get diagnosed with hemorrhoids.
Right.
And that is just a catch-all diagnosis. No one knows the anus very well, so they are all labeled as hemorrhoids. So Dr. McConnell then gets a phone call from the patient asking to see her because they have a hemorrhoid problem. Except that they don't just all have hemorrhoid problems, they have lots of problems. But the fundamental root problem is stool that is wrong in consistency. And by the way, how do I make my stool more normal? Is it something I eat, or is it some medicine I take, or is it my lifestyle that changes my stool?
Primarily it's what you eat. So in other words, many of the diseases of the anus, for example, fissures. If you come early with a diagnosis of fissures, so you have an acute anal fissure, the treatment for an acute anal fissure is just getting on a high fiber diet. So you eat a high fiber diet, it creates big, beautiful, bulky stools. So your stool becomes the size and consistency of a yellow banana, and you don't have trouble with your anus anymore. The fissure will cure itself. So that's an important part to know, that a normal anus wants normal stool. A normal anus has normal hemorrhoidal cushions. Did you know that?
So that means that I don't always want to get rid of my hemorrhoids, correct?
No, right.
Because my hemorrhoid is my cushion to protect me from poor eating habits, poor lifestyle habits, and having bad stool, correct?
Correct. And do you know that there are only 2 places in your body where there's no fat, so subcutaneous tissue? Do you know where they are?
I bet the anus is one of them.
Yes, it is. And your eyeball.
That's right.
So there's 2 places that don't have subcutaneous fat. What does subcutaneous fat do? It protects you. So if you have a bad stool that comes through, what protects your anus?
Wow,
it's the hemorrhoid.
that nice cushion.
Yes.
So basically, a lot of patients who comes to see you for hemorrhoids, they don't actually have hemorrhoids issues. What they have is probably stool that is wrong in consistency, resulting in anal pain, anal bleeding, anal itching, and a whole bunch of problems that are not hemorrhoids but termed hemorrhoids.
Correct. So many times all we need to do is just correct your stool and we make things better. So you had asked about what you do to fix your stool. Well,
Yes,
first of all, we start out with a high fiber diet. So lots of vegetables, beans, fruits, seeds, nuts, and whole grains. Do you know the difference between a vegetable and a fruit?
No, I don't.
So a fruit is something that would grow on a plant. So something that's from the flower, like a tomato is a fruit. Anything that comes from a flower would be a fruit. But any part of the plant, whether it's the root or the stem or the leaf, those are all vegetables.
So you have to have a flower to have a fruit. So that means you need to have both the flowery part and the part of the vegetable plant that is actually healthy and fibrous for you. So that constitutes a healthy diet.
Yes.
And that gives you a good bottom.
Yes, that gives you a happy anus. The magic number is a minimum of 30 grams of fiber a day.
And that will make my anus great again?
Yes. That will make your anus great again.
Unfortunately, I can't fix all my anal problems with diet, can I? I sometimes will need to have surgery. Yes?
Right, and if we get you on a high fiber diet, so 30 grams of fiber, and then you think, oh my gosh, I can't get my poop out. It's so big and so hard and it just won't come out. Then you may need to see us.
Okay, so I think I'm good right now, but several patients might want to come visit you.
Yes.
Because you might need to sit down with them, talk to them about what they're eating wrong and how to have a great stool so that anus can be wonderful and not problematic anymore. Yes?
Correct. Correct. So not all people who come here, in fact, probably, I don't know, 50% of the people who come and say that they have hemorrhoids don't even have hemorrhoid problems. They have other problems.
Exactly.
So the things we worry about are those other problems, because it could be a cancer. Many times we've diagnosed cancer. We see a lot of patients. How many patients do we see a week here?
Well, easily, what, 20, 25 a day?
Yeah.
That's a day.
And sometimes we're diagnosing cancers. In fact, we probably diagnose about 3 anal cancers a week out of this place.
And they came because they had hemorrhoids.
Exactly. In fact, most recently we had a lady who had gone to a vein institute for the treatment of her hemorrhoids.
And you found cancer.
Right. She came to me because she thought I would do a better hemorrhoid surgery, and I examined her, and sure enough, it was a big cancer.
Wow, good thing you were here.
But you know, hemorrhoids are not veins.
They're not. They're cushions for your anus.
They protect your anus.
They protect your anus.
So just think about this. If you gained a lot of weight and you didn't have hemorrhoidal cushions, if you actually had fat in your anus, you wouldn't be able to poop, because your anus would gain poop too, gain weight too.
Gain weight too, yes, because it will be shut from all the weight gain.
So that's the reason why your anus was designed without fat. Isn't that fascinating?
It's very fascinating.
That came to me in the middle of the night one night. I woke up thinking about that.
But I also am surprised at how wonderful the anal sphincter is.
Yes.
Because
there isn't just one sphincter.
Yes, and can you imagine, your hand muscles cannot hold on gas or water tightly. But guess what? Your anal sphincter muscle can. It can prevent you from having gas leak out. It can prevent water from leaking out. That's a wonderful muscle. I don't think there's any muscle that does so well except our lips.
Yeah. And you can actually, the hemorrhoids, talk to the anus and tell them, anus, whether gas or stool is coming through.
Wow.
Isn't that interesting?
It's very amazing.
Now, what's really fascinating too is it distinguishes between gas, stool, and normal stool.
Yes.
So diarrhea, it will not tell you if diarrhea is coming out, because diarrhea is dangerous to the body. So when diarrhea is coming, there's no warning. It comes right out to save you.
I got you.
Whereas if you have gas or stool coming through, the gas and stool, you can distinguish between.
Wow. That is very fascinating.
Those hemorrhoids are really smart.
I think those hemorrhoids are very smart. There's no parts in our body that smart. I don't think so.
And what's even more incredible is you not only have two sphincters in the anus, or not one, just one sphincter in it, you have two sphincters in the anus.
Yes, and they're very important for controlling your stool, particularly the liquid ones, right?
So if you think about an anus, a normal anus, the internal anal sphincter is smooth muscle, which you don't control, and it's the muscle that makes the anus look like that. The external anal sphincter is a skeletal muscle, like your bicep muscle, which you do control.
Right.
So you have a sphincter that looks like that. When gas or stool enter the anus will open. So the objective of the anus is not to obstruct the flow of stool, it's just to warn you that stool or gas is coming through. So when gas or stool enter the anus opens, and then you're immediately told gas or stool, and you then close the anus to make sure it doesn't come through.
So you control the skeletal part of the sphincter, and the hemorrhoids actually probably gives the signal to the smooth muscle, that part of the anal mechanism.
So that's the reason why when diarrhea is coming through, the hemorrhoids tell you whether gas or stool is coming through, but not diarrhea. So you really can't stop the diarrhea that effectively until you start feeling it on your leg.
So diarrhea is way worse than constipation.
It is. Much prefer to have constipation.
Got
It's easier to take care of.
Got it. So come to our office, because Dr. McConnell will make your anus great again.
You keep saying that.
Because that's your mission in life. I think that is your mission in life.
It is. I love it.
See, again, that's your mission.